Hey guys, welcome back to our video series on heel pass syndrome. In this video, we're going to talk to you about how we diagnose it in our office. So the first thing we want to do is figure out what this patient may look like. So a patient with heel pass syndrome, remember from our previous video, they will have pain at the center of the heel of their foot. They're going to feel this pain when they've been walking for a long period or when they've been standing for a long period. Our patient most likely will be a person of an older population, but they can be a younger person if it is an acute injury and a person is most likely an athlete. We also see this in people who are obese, those who have arthritis, and those who may have injuries to their foot. So now that we know what the patient may look like, let's go through some tests to see how we can diagnose this in our office. So the first thing we want to do is see how our patient walks or watch their gait. So we're going to watch our patient walk. What we're looking for here is to see if they deviate from the center of their foot. Typically, people who have heel pass syndrome will not want to walk on the center of their foot because that increases their pain. The next thing we want to do is do some palpation on our patient's foot. So we'll have our patient lay right here on their belly. And we will just grab the heel like so. And we can squeeze around the heel because we know if this area is inflamed, the person may have pain right here on their foot. The next thing you want to do is do some range of motion tests because we found a correlation between decreased range of motion and heel pass syndrome. So our patient will lay on their back. We're just going to check their dorsiflexion here. We're going to raise the foot up here and just see how the foot bends. And we're also going to test their big toe flexion here. The last test we want to do is a foot strength test because people who have heel pass syndrome usually have weak toe muscles. So we'll have our patient bend their knee here. We're going to put a piece of paper under our patient's foot. Our patient will apply pressure to the paper here, and we're going to pull and see the paper will move. So now that you know how we diagnose in our office, I want you to stay tuned. In our next video, we're going to show you how we treat in our office.